So this regimen has showed this great magnitude of benefits in the primary endpoint population, which was based on the IMDC assessment, intermediate and poorest patients, accounting for about 80% of our patients. With regard to biomarker, what we do know is that PD-L1 expression is associated with an enhanced likelihood of response. However, we cannot rule out a patient and exclude a patient from the opportunity to receive this treatment and this approach based on PD-L1 expression. The thing that we should have in mind is that patients with sarcomatoid features, who usually have a very dismal prognosis, seems to derive great benefit of the combination. So clearly, this is something we should have in mind when we see a patient that has some degree of sarcomatoid features on the tumor. With regard to biomarker development, there's a lot of work ongoing, and some study presented at this ESMO 2020, like the Bionic trial, try to investigate if we can select the treatment based on gene expression profiling. I think it's a proof of concept trial, as it was prospectively assessed that patient had the gene expression profiling and defined in this trial what regimen they should receive based on randomization. So it's more a proof of concept. Nevertheless, it also shows us that in some patients that had high immune infiltrate, it is likely that we may not need a doublet. However, because we're not yet able to select those patients up front, my recommendation is that we should go for a combination therapy until we have the opportunity to identify before starting the treatment who is likely to respond to single agent.